Hi guys, I hope you're having an absolutely brilliant week. Today I wanted to talk about healthcare jobs and how you can move to the UK with a healthcare job, specifically because one of my friend's wife just got an offer and just moved to the UK for a healthcare job. And well, I get a lot of questions from a lot of you asking me specifically how to move to the UK when they are healthcare professionals. Now, like I've said in previous videos, the UK is facing a shortage of healthcare professionals to the tune of more than 100,000. So if you are a healthcare professional or work in a healthcare professional related job, I genuinely suggest you watch this video all the way till the end. With that, let's dive in. Now, in order to move to the UK with a healthcare job, the first thing you need to know is what the NHS is. The NHS, or the National Health Service, is UK's healthcare system. It's run by the government, but here's the thing. There are lots of other medical providers that are private individuals, there are private insurance agencies, and allied healthcare services. The good news for you, like I just said, is that the NHS is looking to hire hundreds of thousands of doctors, nurses, and other healthcare professionals. Now, in order to come to the UK and work as a healthcare professional from a different country, you need a health and care worker visa. The Health and Care Worker Visa allows you to move to the UK and do a job with the NHS, an NHS supplier, or adult social care. Now, in order to be eligible for a Health and Care Worker Visa, you need to be a qualified doctor, nurse, healthcare professional, or adult social care professional. You need to work in an eligible healthcare or social care job. You need to work for a licensed sponsor. You need to have a COS or a certificate of sponsorship from your employer with information about the role you've been offered in the UK. You must be paid a minimum salary, and you must be able to speak, read, write, and understand English. Your visa can last for up to 5 years before you need to extend it, and you'll need to apply to extend or update your visa when it expires if you change your jobs or your employer. You can extend your visa as many times as you'd like, and you can also apply for an ILR if you meet the eligibility requirements after 5 years. An ILR will allow you to remain in the UK indefinitely. When you apply for a health and care worker visa, you'll need to have enough money to pay the application fees, and for up to 3 years, it's £247 per person. For more than 3 years, it's £479 per person. You'll need to support yourself when you arrive in the UK, and you'll usually need to have at least £1,270 available unless you're exempt. Your partner and children will also need to prove that they can support themselves while they're in the UK. So that's £285 for your partner, £315 for one child, and £200 additional for every additional child. Now, unlike in the case of other visas, you will not have to pay a health surcharge, so you save on hundreds, if not thousands of pounds. While you're on this visa, you can work in an eligible job, you can take on additional work in circumstances, you can take on additional work in certain circumstances, you can do voluntary work, you can study, you can bring your partner and your children with you as dependents if they're eligible, you can travel abroad and return to the UK, and you can apply to settle permanently in the UK, known as an ILR, if you've lived in the UK for 5 years and meet the requirements. Now, for more details on salary requirements and to check which jobs fall under the shortage occupation list, because it's a different list from the normal list, I suggest you visit the gov.uk website, and I will link it below in the description. Now, before we get into how you can actually get a job in the UK as a healthcare professional, I quickly wanted to go over how much you can expect to make as a healthcare professional in the UK. In foundation training, you will earn a basic salary of £29,384 to £34,012. If you're a doctor starting on specialist training in 2022, your basic salary will be anywhere from £40,000 to £53,000. If you're working as a specialty doctor, you will earn a basic salary of £50,000 to £78,000. If you are a specialist grade doctor, you'll earn a basic salary of £80,000 to £91,000. As a consultant, you'll earn a basic salary of £88,000 to £119,000 a year, depending on the length of your service. The pay scale for salaried GPs is anywhere from £65,000 to £98,000. As a newly qualified nurse, you'll start in Band 5, which means you'll earn over £25,000 a year, and it will increase annually until you reach the top of your pay band. Newly qualified dentists make an annual salary of £34,000. Dental core trainees earn a basic salary between £40,000 and £51,000. Dental specialty trainees earn a basic salary between £51,000 and £58,000. Salaried dentists employed by the NHS, working mainly with the community dental services, earn a basic salary between £44,000 and £96,000. Consultants in dental specialties earn a basic salary of between £88,000 and £119,000 per year, dependent on the number of years of seniority in the consultant grade. But before I move ahead, if you haven't hit that subscribe button, now's an absolutely great time to do it. Hit the subscribe button now and click on the bell icon for notifications. Amongst other things, I make videos on moving to the UK and have a whole lot of information, including job openings posted very often. Now, how to get a job in the UK as a healthcare professional. Let's start off with the obvious. I showed you the salaries for an obvious reason. You need to understand how much you can expect to be paid in the UK versus what your expenses are going to be, especially if you're the only person in your household who's going to be earning, or if you're moving here as a single individual. If you'd like to get an idea of what your expenses are going to be once you move to the UK, there's a whole separate video, so I'm not going to talk about that here. I will link it in the description below so you can watch it at your leisure. Now, the next thing you want to do is make your CV. Now, like I've said in all my videos in the past, it's extremely important for you to make your CV basis what you believe the recruiter wants to know, and also find a way to integrate all your qualifications and your experience in it. But it should specifically talk about the job that you're applying for and tell them everything that they need to know to hire you. Now, if you need help with making that brilliant CV, I've made another video on that and I'm not going to cover it in this video. So all you need to do is, again, head to the description. I have linked it over there. Watch it at your leisure and make a brilliant CV. Now, something else you need to know is that if you want to apply to work in the UK as a doctor, you need to apply for GMC registration. To apply for GMC, you'd have to have passed the PLAB test and also passed the English language requirement test. Once again, all of these links are in the description. The next thing you need to do is create a profile on the NHS Jobs website. The NHS Jobs website is honestly going to be your biggest source for getting jobs in healthcare roles. Create an account and start filling out your personal information. On the left, you can see what is mandatory for you to fill out and what is not. Anything marked with a check mark is not mandatory. You will be asked if you have the right to work in the UK, which basically means if you require sponsorship. And you need to say yes so that they can keep it in mind while deciding if you are a good fit. If you don't have a UK national insurance number and you're not British, click no. If you don't belong to the EU, EA or a Swiss national, once again click no. And move to the section that asks you about immigration status. If you're looking for sponsorship, you'll see that you probably have none of these visas mentioned here. So click others and in the box below, write out that you require sponsorship. Next, upload your CV here and go on to fill out the rest of the form. As a part of the form, you'll be asked whether you have GMC registration. Something else you need to keep in mind is that you'll have to provide 3 references that should cover at least the last 3 years of employment or education or training. Your referees should be your line manager or your HR department. One more thing. You'll have to write a supporting statement to show how you meet the requirements and why you are applying for the role, including highlighting your strengths, talent, or anything that sets you apart. Filling out the application might consume a considerable amount of time, so I genuinely suggest you park aside a good amount of time for it so you don't rush through the entire application, so that you can take your time and fill out the most appropriate answers versus just having to finish off the application as quickly as you can and apply for the next job. It's not going to help you. Take your time. Think about what you are writing. What you should also do is check TRAC jobs and set an alert over there for whatever profile you're looking for, and go back to the NHS job site and apply every time you get that alert. Apart from that, I also suggest you keep checking LinkedIn and Indeed for job openings, especially in the private healthcare field. The most important thing for you to understand is that you need to do this consistently and not very sporadically, because if you do it sporadically, you're not going to have much luck. And the honest truth is that a lot of people, hundreds and thousands of people, have been getting through for these roles and have been getting sponsored to move to the UK for healthcare roles. So the trick is to be consistent and persistent in applying for these roles. Now, if you have been applying for a while and you feel you haven't been getting responses or you've been getting rejected, you might want to go back and look at your personal statement and look at your CV and see if you can spruce it up a little bit. Like I've said repeatedly, CV writing is a skill because it's a skill that helps you land a job. Not everyone lands these jobs. Some people do, and these people are people who know how to create brilliant CVs to get their foot into the door. Now, if you need help with crafting that perfectly brilliant CV that is going to help you stand out versus all of the other candidates that are applying, I genuinely suggest you watch this video.